This morning in today's checklist, we're showing you how to take control of your health right at home. Annual doctor's visits are important, but there are also some DIY health checks we should all be doing regularly. Here to tell us all about it, NBC News medical contributor Dr. Natalie Azar. Good morning.
Good morning, Jill.
And we have Marina here for us. So let's start with blood pressure.
Yeah.
Now, we've all had this done at the doctor's office, but who should be doing it at home, and what's the right way to do it?
Yeah, so the American Heart Association recommends that if you are on blood pressure medication, you're a high blood pressure patient, that you can check your blood pressure at home. Yeah. So we're going to demonstrate on Marina. One thing that I would like to point out is that generally we want to have the forearm resting on a surface. You will notice sometimes when the nurse takes your blood pressure in the office, they hold your arm sort of in the crook of the waist. You want the cuff to be at the same level as the heart. What's important to remember is that you want to do a couple of readings 1 to 2 minutes apart at the same time every day. It's also really important that you don't want to drink caffeine or smoke or exercise in the 30 minutes before you do your blood pressure, because guess what? It'll be falsely elevated. The other thing that I always want to make sure that people understand is that if you're checking your blood pressure at home, make sure it matches up with the blood pressure taken at your doctor's office. So if you do it every day, like around 10 o'clock, the next time you're at the doctor's office at 10 o'clock, make sure it's calibrated so that you actually get a good measurement.
So how's Marina?
She's 127/91. I was a little high before as well, and guess what? You're a little bit nervous, right? Normal blood pressure is 120, below 120/80. So Marina, we will check it.
Below 120. Did you have coffee this morning?
Yes.
Did you have coffee?
It's the show.
Coffee this morning and being on TV.
I never am high. I was high also.
And we drink coffee right before we come here.
Right.
Exactly. All the no-nos.
Heart rate and oxygen saturation. Why are those numbers important?
So the pulse oximeter, we talked a lot about this during the COVID-19 pandemic. It measures your heart rate and it can measure your blood oxygen level. And look, Dylan appropriately doesn't have any nail polish on. That is ideal.
Well, my mom would be upset that I have to.
So heart rate, normal heart rate is between 60 and 100. This is good for people who maybe are on heart rate lowering medication, or if you're feeling a little funny, you want to check your heart rate. I cannot do this segment without mentioning the issue with pulse oximeters and individuals with darker skin. This has been known for many decades. The FDA is aware of it. What can happen? What do your readings say?
I didn't turn it on.
Oh, you didn't turn it
Step one.
What can happen? Step one, turn on the machine. What can happen is that if you have darker skin, the pulse ox can actually overestimate how much oxygen you have in your blood. So until we have pulse oximeters that are calibrated to every skin type, I would recommend, if you're darker skin and you have a pulse ox, measure it when you're healthy so that you have something to compare to if you're not feeling well. Normal oxygen saturation on this is 95 to 100. What are you?
I'm not coming up with anything.
You're not coming up with anything, but guess what?
I'm probably nervous.
You are
my fingers are
alive.
cold. My hands
Yeah,
are
I know.
cold.
You can warm them up. Just in case anyone's wondering, I was normal. Okay. So now we're going to do. Guess what we're going to do now? We are going to measure your heart rhythm. Put one finger of each hand on there. And I am going to press record your EKG. This is a home EKG monitor. Okay. This is for somebody who, for example, might have a history, and it's 30 seconds. Is it going? Great signal, it says. So far, so good. This would be for someone who maybe has a history of atrial fibrillation and arrhythmia. Their doctor says, measure your rhythm. Again, ideally within, not within an hour or two of exercise or something like that. I have to also say, always important, that if you're feeling sick or you're not feeling well, and you're lightheaded or dizzy, don't just check this. Please, call 911 or call your doctor. For some reason, it's not picking up.
That's really cool. I've never even heard of this.
I know. We may not have a good Wi-Fi signal, but again, Dylan is alive.
I'm actually dead.
Yeah.
Waist circumference.
Oh, no, we haven't dealt with that. So here's the thing. Why would we want to torture ourselves if we are waist circumference?
Okay.
I'll do mine. I don't care.
Do it. Okay. So we're checking waist circumference because you might have a normal BMI and be quote unquote a normal weight. Yeah. But if you have excess fat around the middle, that's the visceral fat. That actually dramatically increases your risk for heart disease. For women, you would like this to be not greater than 35 inches. 35 or above is considered a risk factor for heart disease.
But I'm 4'11", so I feel like mine should be, I'm 31. It should be,
you're right. They probably should sort of make it a thing based on height. And for men, it's 40 inches or above. Okay. But this is really important. I don't want to understate how important it is.
Really?
Last one. Okay. We're going to do this. Our researcher, Natalie, is going to show us the sit to stand test.
Oh,
if you can do this without using your hands and your knees or your arms, you get a total of 10 points. Yay. a study out in 2015, if you weren't able to do this, I know, I can't do it with these shoes either. It's about agility and muscle strength. It's not just about aerobic fitness.
Can you do it again?
Do it again.
How? So wait.
So if you can't do that,
okay,
you do have a higher risk of you-know-what in 6 years.
Really?
Based on a study from 2015,
Hold on, let me take my shoes
which
off.
I'm not sure has been replicated. Do it,
I want to try. You keep talking.
Yeah, now I'm very
kind of out of time, aren't
I know.
we?
I'm going to try to
Okay, well, she's
Everyone at home,
Dr.
try it.
Natalie, thank you,
You
so
are so
much.
welcome.
And that was amazing.
Is there anything you can do
coming up?
Great
Our
job.
celebration of International
Yeah, you can go down like this. You can
continue.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.